Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Throat disorders and problems. Introduction. Your throat is a tube that carries food to your esophagus and air to your windpipe and larynx. The technical name for throat is pharynx. Throat disorders and problems are common. Most throat problems are minor and go away on their own. Treatments, when needed, depend on the problem. They may include medicines, surgery, or other treatments. This program explains throat disorders. It covers common disorders and problems that affect the throat, as well as their treatment options. The throat. The throat is also called the pharynx. It is a hollow tube that starts behind the nose. It ends at the top of the trachea, or windpipe, and esophagus, or feeding tube. The pharynx carries food from the mouth to the esophagus. The esophagus takes food to the stomach. The pharynx also carries air to the trachea and larynx, or voice box. The pharynx is made up of three parts: the nasopharynx, the oropharynx, the hypopharynx. The larynx is also a part of the throat. It is sometimes called the voice box and is located between the base of the tongue and the trachea. The larynx contains the vocal cords, which vibrate and make sound when air moves against them. The sound echoes through the pharynx, mouth, and nose to make a person's voice. The epiglottis is a flap of tissue at the upper part of the larynx. It covers the trachea during swallowing so that food does not enter the lungs. General symptoms. Symptoms of throat disorders can vary widely and depend on the problem. The most common symptom of a throat disorder is a sore or painful throat. Other common symptoms of throat disorders are a scratchy or hoarse voice, difficulty swallowing, dry cough, extreme tiredness, trouble breathing or speaking. Some throat disorders may also cause enlarged lymph nodes in the neck, fever, frequent headaches, heartburn, pain or ringing in the ears.
People with cold or flu can get a sore throat. COVID-19 infections can also cause a sore throat. However, not all people who have COVID-19 have a sore throat. The main symptoms of COVID-19 are fever, fatigue, shortness of breath, and dry cough. Most patients with COVID-19 experience a temporary loss of the senses of smell and taste.
Throat disorders can cause other symptoms as well. If you notice any of these symptoms or other changes, talk to your healthcare provider.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Strep throat. Strep throat is the most common throat infection caused by bacteria. It causes a sore, red throat. It can also cause white spots on the tonsils. Anyone can get strep throat. It is found most often in children between the ages of 5 and 15. Strep throat is usually caused by group A Streptococcus bacteria. These bacteria are commonly found in the throat and on the skin. People may carry this type of bacteria with no symptoms of illness. Contact with saliva or fluids from the nose of an infected person can spread strep throat. Strep throat may be more common in crowded living spaces. Sometimes food that contains strep bacteria can also cause infection. Milk is one example of a food that can become contaminated with the bacteria. It can take a few days to become ill after coming into contact with the bacteria. You can pass the bacteria to others even after your symptoms go away. You may be contagious for as long as 3 weeks after exposure to the bacteria. Strep throat can cause serious complications and lead to other illnesses. The infection can spread in the body and infect the blood,
middle ear, sinuses, skin, tonsils. Antibiotics are used to treat strep throat. Antibiotics are special medicines used to fight bacterial infections. Antibiotics must be taken exactly as prescribed by your healthcare provider. You must take the full amount for as many days as your healthcare provider tells you. It may make the infection worse if you stop taking antibiotics too soon. Tonsillitis. Tonsillitis is an infection in the throat that affects the tonsils. The tonsils are glands located on both sides of the back of the mouth. The tonsils are part of the immune system and help fight infections. Tonsillitis usually causes a severe sore throat and fever. Swallowing becomes painful and difficult. The tonsils may get large enough to touch each other. When this happens, it is known as kissing tonsils. The adenoids may also become infected. The adenoids are located behind the soft palate. The soft palate is the back muscular part of the roof of the mouth. The adenoids are also part of the immune system and help fight infections. Enlarged adenoids can be sore. This can make it hard to breathe. It can also cause ear problems. Treatment of tonsillitis and enlarged adenoids usually requires antibiotics. If left untreated, tonsillitis could damage other organs in the body such as the heart or kidneys. In some cases, surgery is needed. A tonsillectomy is an operation aimed at taking out the tonsils. An adenoidectomy aims at taking out the adenoids. In some cases, both the tonsils and adenoids are taken out. Heartburn and GERD. Almost everyone has heartburn sometimes. Heartburn is a painful burning feeling in your chest or throat. Heartburn happens when stomach acid backs up into your esophagus. Often heartburn is caused by eating certain foods, such as fatty and fried foods, garlic and onions, spicy foods, tomato-based foods such as spaghetti sauce, salsa, and pizza. Other foods that can cause heartburn are chocolate, citrus fruits, drinks with caffeine or alcohol, mint flavorings. If you have heartburn more than twice a week, you may have GERD. GERD stands for gastroesophageal reflux disease. GERD happens when the muscular ring at the end of the esophagus does not close properly. This allows stomach contents to flow back or reflux into the esophagus and irritate it. The acid may also irritate the pharynx. Sometimes the stomach acid can travel all the way up the esophagus to the mouth. From the mouth, the acid juices can flow into the lungs and cause damage. The same foods that cause heartburn can cause or worsen symptoms of GERD. GERD may also be caused by being overweight or pregnant. Other medical conditions, such as hiatal hernias, increase the chances of having GERD. The first treatment for GERD is often lifestyle changes, such as eating small meals frequently throughout the day instead of eating large meals, eating at least 2 hours before bed, elevating the head of your bed about 6 inches, quitting smoking. Sometimes medicines may be taken to decrease the acid in the stomach. Some medicines are available over the counter. Others require a prescription. Rarely, severe cases of GERD may be treated with surgery. Cancer. Cancer begins in your cells, which are the building blocks of your body. Normally, your body forms new cells as you need them by replacing old cells that die. Sometimes this process goes wrong and a tumor forms. If a tumor is cancerous, cells from the tumor can invade other tissues throughout the body. Cancer cells can spread to different parts of the body through blood vessels and lymph channels. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the throat will always be called throat cancer. This is true even if it is spread to other places in the body. Throat cancer is a type of head and neck cancer. Throat cancer has different names depending on what part of the throat is affected. Sometimes the larynx or voice box is also included. Tobacco and alcohol use are the main risk factors for throat cancer. Other risk factors include being exposed to certain viruses, such as the Epstein-Barr virus or HPV, Eating a diet low in nutrients.
Treatment for throat cancer may involve surgery, radiation therapy, chemotherapy, targeted therapy. Talk to your healthcare provider to learn what treatment plan is best for your condition.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Your throat is a tube that carries food to your esophagus and air to your windpipe and larynx. Throat disorders and problems are common and can include strep throat, tonsillitis, heartburn and GERD, throat cancer. Symptoms of throat disorders can vary widely and depend on the problem. The most common symptom of a throat disorder is a sore or painful throat. Other symptoms include a scratchy or hoarse voice, difficulty swallowing, dry cough, extreme tiredness, trouble breathing or speaking.
Most throat problems are minor and go away on their own. Treatments, when needed, depend on the problem. They may include medicines, surgery, or other treatments.
Thank you for using Explain.